Doctors of Reddit, what's the biggest case of faking it you've ever seen? My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard, and she'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses, but the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision and her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. I'm an IQ and a nurse. We get a lot of malingering in the air. One day, one of our frequent flyers came in and started faking a seizure in Tridge. Now obviously I know this lady and she's fake seized a million times before. But this time it's in the lobby in front of about 30 people who have no way of knowing that it's fake. She's lolling around on the floor making a damn fool of herself, and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing. So she did. Edit. No, her name wasn't actually Karen. I just did that for confidentiality. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated "hello wave." She started to throw her arm up too, but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. A friend of mine likes to stick out her hand for a handshake when people come in feigning blindness. Nearly all of them instinctively meet her handshake. It's great to watch. Edit. I'm very much aware of the different types of visual deficits. Thanks for your concern. When I was a kid I learned I could fake sick and get out of school. So 1 to 2 days a week I would get a migraine and hold my head and complain and I would get to go home. Eventually my parents took me to a neurologist who said maybe you just don't let him eat chocolate and sugar. I admitted to faking and was grounded for a long time. I grew up the opposite way. I would get 3 to 4 migraines a week, but everyone thought I was faking it because most days I seemed fine, just because I was learning how to deal with them and try to act normal. It wasn't until 8 years after they started that I went to a neurologist who said I have chronic migraines, which I dealt with unmedicated for 16 years. Now I'm on medication. I feel like my childhood was wasted. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with the Tonopin, a device you poke them directly into the eye with, and they go, "What the duck is that thing?" I have a sort of opposite angle story for this one. A friend of mine is completely blind, as in, eyes removed as a toddler blind. She had a rare cancer. She's worn glass eyes her whole life to keep the sockets from sinking in, as well as to limit the jarring appearance. Well, she had a new doctor she was seeing, so to speak, to get fitted for new glass eyes. I think that was why, when the tech brought her in, they told her they had to examine her eyes, and asked her to read the vision test chart. She kept trying to explain she is blind, and they were stuck on examining her. Whoa, your pupils aren't responding. No crap. She finally got so frustrated, she popped one glass eye out and said, "Here, now you can check it out all you want." She apparently always would pull that gag on folks doubting her and or teasing her. She's awesome that way. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever, leave it on the windowsill in my bedroom just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug, and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. I was worried you were going to drink it in order to make yourself sick. Thank goodness that is not what happened. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual Lyme crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call, but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic with her I'm crippled jet up on again. A few weeks later I got the subpoena for the deposition, and it all became clear. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy. Nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat, as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. There's an even easier way. Just take their hand, hold it over their face, and drop their hand. If they are truly unconscious, or drunk, or very out of it etc., they'll smack themselves in the face. If they are conscious, they will always do something to lessen the hit, like make their hand land to the side, or they turn their hand and hit somewhere they think it won't hurt, etc. Edit. Okay, so apparently, you shouldn't do this. Don't do this, guys. 4th year medical student. On my rotation and a trauma came in from a woman that had been arrested. During the drive the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor, didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay, though some of the nurses said that they caught her peeking at us when would leave the room. We ended up getting a CORD scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids, and held them open while telling her to wake up. Finally she started fighting to close her eyes and the jig was up. The doctor called her out, and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. My brother was an EMT for 2 years, and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego because the hospital is in Oswego by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures, but not peeing himself." Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. We had a family calling for a Medicab, a cab paid for by income-based insurance, from somewhere out in the sticks to our in a college town. Every few weeks or so, the mom would be seen for some ailment or the other, and the rest of the family would go to Walmart, go to the mall, do all their in-town errands. She was basically faking an emergency illness every few weeks, so they wouldn't have to pay for a cab to get their shopping done. I'm not a doctor but a nurse. There was a geriatric patient taking advantage of the call bell because she was an attention seeker. She always needed really basic things to get done for her because she thought the place was a hotel. It was a rehabilitation ward, and we should try to motivate patients to do as much for themselves as possible. She would ring the bell for reasons like, "Please lift the blanket up for me," or "Please pass me my phone," or "Please feed me," and claimed that her hands didn't work. I caught her several times lifting herself off the bed with her hands, grabbing her phone when it rang. You get the gist. After days of saying no, and that she needs to start doing things for herself, she grew more and more frustrated. Eventually she snapped, grabbed me by my collar, shook me aggressively, and yelled, "What don't you understand about the fact that my hands don't work?" I didn't know what to tell her. I just looked at her and blinked as she slowly released her death grip off me. I guess I healed her hands. Praise the Lord. 1 upvote equals 1 prayer for an old lady's arthritis. We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery without intervention. That's the best part about most of these stories, when they make up some form of fake machine so that the patient stops faking. Cracks me up every time.